in and out. Got it? That's just like these things. These ducts. They just ventilate. They bring in the cold air, but they're not making the air cold or making the air warm. That's the exchanger outside. Got it? So, respiration is the actual exchanging. So, on my test, I'm going to ask you, which of the following is external respiration? Well, that's air from outside being exchanged in my lungs. Got it? Exchanged with the outside world. Internal respiration is in my capillaries in my body where I exchange with the internal gases. Does that make sense? Okay. And please be aware, if it's an external change, it's oxygen in, CO2 out. But if it's in my internal, I'm picking up CO2 and putting out the O2. Okay? All right. And of course, your blood does the transportation between your lungs and your tissues. All right, conducting zone and respiratory zone. Again, conducting zone, like these conduits here, just get the air in and get the air out. So it's your nose and your trachea, got it? Your large bronchioles. The respiratory zone are the small bronchioles and the alveoli. That's where the exchange takes place, okay? That's why it's called the respiratory zone. And we can also look at things as being the upper respiratory, here up, and the lower, here down. Okay? And of course, when we look at the models, whether we look at them physically in class or you have them online, just keep in mind, we're going to need to know what's happening in here, okay? As well as who are the bronchi. So, just quickly, how many lobes do I have on the right side? How many on the left side?
2.
Why not 3? The heart takes up so much space, we can't put a third lobe. And because the heart is there, you see that cutout right here? That's called the cardiac notch. Okay? We've notched it out for the cardiac. Alrighty. Did we talk about the lady who had the flipped heart? Yeah. Okay. So all of this was mirror image for her. Got it?
The notch was on the other side as well?
Yeah. So she had 2 lobes and 3, because everything is flipped. That's why it's called C2 inversus.
Well, like, I know they realized that whenever she was a child or whatever.
Yeah.
Like, if something happened, say she had gotten in an accident and had to be rushed to the hospital, how would they immediately know that that's...
Maybe if they discovered it as a child, it might be on the driver's license or something when they get older.
I mean, I would want something
Yeah.
to say.
But I think somebody said that they, or the wrist, I think if I read the article correctly, she only knew this 20 years ago.
Oh my goodness. Like,
So
I would
she's
want
gone her
that.
whole life without realizing that. Yeah. Yeah. Now there was a case of a person who got shot in the head, okay, got shot here, but they can still talk. So what happened? Their broken Wernicke were here on the right side. 10% of people have it flipped. The other 90% have it on the left side, like it's supposed to be. So, all right, same thing. I think there was a case where somebody got shot through the chest. So they got shot here, but it didn't pierce their heart because their heart was on this side. Yeah, so it went through their lung. Okay, I need you to know this for your test. When we breathe air, we do not put the air from this room directly into our lungs. We have to humidify it with the mucus in our nose. We have to clean it with the mucus and the hairs in our nose. We have to, what? Warm it with the capillaries and the warm blood, okay? So, and that's why we have to slow it down first with those little nasal concha on the inside of our nose. All right. And see, there's 3 of them. Superior, inferior, in the middle. All we can see are these 2 through the nose, because this superior one is behind the nasal bone. All right. Alrighty. What are sinuses? Sinuses are openings in our head. They have several functions. Number 1 is to make your skull lighter, so you don't have to have a neck that's 4 feet wide to hold solid bone, all right? Secondly, it's where we resonate our voices. You sound totally different when you don't have it going through these parts. Got it? Okay. See, resonate the voice. And of course, when your sinuses get infected, I got a sinus headache, right? But not a lot of fun, all right? And you got sinuses in the frontal, in the sphenoid bone, in the ethmoid bone. What the heck? Don't tell me. What the heck? It all disappeared? I can't read it, okay? What the flip? All right. If I have the same function in 2 different places, we use the same tissues. Simple squamous cells in my alveoli to exchange gas, and simple squamous cells in the capillaries to exchange gas. Does that make sense? Okay, so we got the same stratified squamous where there's food scraping my mouth and my esophagus, or clothes or whatever scraping on my skin. Got it? All right. Now, I want you to understand this is a key concept. This comes from the root word passive. Now, we call it passive with the S's. In the Greek, it was patent with a T. Does that make sense? Now, this is not a patent like, I invented something, give me a patent. That's something different. This is a patent airway. What does that mean? Your esophagus, your trachea is always open. We only close it when food is coming. So we can close it down. We want to close it so that when the food is coming down, I don't want it to go into my windpipe. I want it to close this and it goes down your esophagus. Does that make sense? Okay. But this is always open. In fact, this door is called the epiglottis. What's the doorway called? Glottis. Okay? It's above the glottis. All right. All right. The larynx is also known as the voice box. All of these little things here are for lab, including the laryngeal prominence called the Adam's apple. Okay? Is that on everybody or just guys? Okay, just males. Why? It's just one of the sexual characteristics of a male. Got it? It doesn't really mean anything. Now, if you were a little anole, have you guys seen those little green lizards that run around on your back porch in the summertime? The males have that nice big red crest kind of thing that he shoots out to attract the female. Got it? He'll go like this and he'll bounce his little head up and down, and the female will run, oh, okay, let's run off and make a baby. Got it? Are you with me? All right, back, you got to understand one of the things. Who chooses the mate? The female or the male? Female always, because the cardinal bird has to be pretty. The peacock has to be pretty. Got it? The weaver bird has to weave a nice nest. All right. Okay, and the rest of this stuff is all for your lab. All right? Why is it called Adam's apple?
Because Eve had the apple,
Okay, see, Eve swallowed the apple, and in the Bible, Adam realized halfway down he had made a mistake, and so they say it got stuck, to show that they both sinned. All right. That's kind of cool, looking down somebody's throat. All righty. The cool thing is, these 2 little tiny things here are what make all the sounds. Got it? Everything else around it is called false vocal cords or vocal folds. It's just those 2. Who was it that just had their vocal cords messed up? Julie Andrews a couple of years ago. They cut right through it with their surgery. Now she talks like this. She can't sing at all. She sings like a frog. But like she said, well, I had a good run at it, so what am I supposed to do? Sue somebody? I can't get them back, right? But no, this other guy, one of the lead singers of one of the groups, like Styx or whatever, I forgot. I saw that on the news just the other day. He also had a little node on his vocal cord, and they were going to laser it off, and then halfway through the, oops, that's the last thing you want to hear. So that guy can't sing anymore either.
Can they
All right.
fix them if they break them or tear them or cut them? They can't put them back together?
No. That's like putting together a guitar string. When your guitar string breaks, you put a new one in. Yeah. Hello. Okay, that's a test question. Valsalva's maneuver. Okay? This is right up your alley, Justin. Valsalva's maneuver is where we artificially close the glottis to build up pressure so we can either lift a load or drop a load. Got it? All right. You hear all about dropping them. All right, so. But that's called Valsalva's maneuver. 10-4? All right. Okie dokie. See? Patent airway. Remember. That's why it's cartilage, folks. It's always open. What's your esophagus? All smooth muscle. Always closed till food starts going through it. Got it? Just like your intestines are closed till food goes through it. That's why, do we do a colonoscopy in the small intestine or only the large intestine? Only the large. We do not go into the small intestine because it's so small that the camera that we put on the, the camera on the end of the garden hose might tear through your small intestine. If they want to see what's happening in your small intestine, they can do one of two things. Give you an MRI where they can see the insides, or make you swallow a camera that takes pictures as it goes all the way down till it ends up in the toilet. Then you got to fish it out, clean it up, and mail it back to them. And then they can watch the film. Got it? All righty. Trachea, 3 layers. The mucosa on the inside. Adventitia, we've seen the word adventitia before. That's the outside for protection. And under the mucosa is the submucosa. All right. Lab practical. This is the trachea. This triangle here is called the carina. The word carina means the keel of a ship. Well, the keel of a ship is wide at the top and pointed at the bottom to keep the ship upright. You have 2 main bronchi for the left and the right, but then immediately this branches into 2 secondary bronchi. Primary bronchus, secondary bronchi for the 2 lobes here, and 1, 2, 3 secondary bronchi for the 3 lobes on the right side. Then the next branch after that is the tertiary. Got it? Primary, secondary, any of these are tertiary. Primary, secondary, any of these are tertiary. Primary, secondary, tertiary. Secondary, tertiary. Okay? And they call them segmental too if you want to learn that. All right? There's your cilia. Okay? Catch that stuff and move it so we can swallow it in our esophagus and kill it in our stomach acid. Whatever it is that we're breathing in by accident. All right? Ever heard of a tracheotomy? Yes or no? Yeah, okay. So it's an opening. And a tracheostomy. Okay? So tracheostomy is putting in a trach tube. Tracheotomy is making the cut. Why? Because guess what tomy means? To cut. Anatomy means to cut somebody up. All right? All right. So that's why I found this online. Tracheotomy versus tracheostomy. Creating the hole, inserting a tube. Okay? You'll be not making the hole, but you'll be cleaning the trach tube. Does that make sense? So you got to be aware of these terms. All righty, and we call it a bronchial tree because it splits. In fact, from the main bronchi all the way down to the little tiny one, it splits 22 times, getting smaller and smaller and smaller as we go along. As they move and get smaller, what they're made of changes too. All of this is hyaline cartilage to stay nice and firm. Got it? When we start going in here, it becomes cuboidal cells. All righty? All right. But there you go. And you have horizontal fissures between the lobes or an oblique fissure between the lobes, depending on what angle it's at. All right? All right. Cartilage disappears because cartilage, can you squeeze cartilage? No. And I got to be able to squeeze my bronchioles, my little bronchi. So they turn into cuboidal cells covered in smooth muscle so that I can bronchodilate and bronchoconstrict. Got it? Okay. Yeah, all right. See? All the little alveoli, and that's one of your bronchioles going in. Got it? We call it a respiratory bronchiole with the alveoli on it. Alrighty. What are the cells? They're simple squamous for exchange, but you also have what are called great alveolar cells, or type 2s, and the macrophages, which they call the dust cells. Gee, I wonder what a dust cell eats. The dust that might have gotten all the way down into your alveoli. All right? Now, here's what we need to keep in mind. Your alveoli is basically a bag, okay? And that bag has a layer of water in it. That's why we have to humidify the air before it comes in. Otherwise, you'll dry out these things and break your alveoli, like drying out a wet tissue paper and then it gets fragile. Does that make sense? And of course, where are the blood vessels? Here. To the outside. So if I want to breathe in O2, it's got to go through what? Water first, simple squamous second, to get down to the blood vessels third. Are you with me? Okay. So, do I want a bunch of dust and other particles getting in the way? No. And that's why smoking something that's been burned is not a good idea. Because those burning pieces of whatever, you know, whether it's a left-handed cigarette or a normal cigarette, it's going to coat the inside. Aren't you doing that? Right? Bongo Debbie over there was telling us that's how it works. Okay? So, are you with me? All right. And what did we say about vaping is not a good idea? I didn't? Okay. Does vape come in flavors?
Yes.
And all those flavors are what? Essential oils. So now we're going to put a layer of oil on top of the water. Is that going to make it easier or harder for gases to go to the water?
Harder.
Exactly. Okay. All righty. So, nice little picture here. Simple squamous cells, but here are two specialized cells. You got your dust cells running around on the inside, doing the best they can to clean up. And then we have this, the type 2 cell. The type 2 cell makes something called surfactant. Have you ever heard of surfactant? Okay. Have you heard of detergent? Okay. Have you heard of blowing bubbles? Got it? What do you add to water to blow a bubble? Dawn. Got it? Detergent. Why? Because it lowers the cohesion and adhesion of the water's surface. Because actually inside every alveolus is a drop of water. How did that drop of water end up being on the outside and air on the inside? Because we make surfactants with this, same thing as Dawn, and it actually opens up the water. Got it? Like when you're blowing a bubble, the bubble is water with air in it. Got it? Have you ever seen a blown a bubble and kind of seen like, looks like kind of a mirror image on it? That's the little thin layer of detergent. Got it? Okay. Preemies don't make this. That's why they have to have positive respirators. All right? But we can spray in artificial to help them so they can breathe on their own. All right.
You said the surfactant lowers the surface tension
Of water. Of the water drop. Otherwise, the water drop wants to be together. But we can open that water drop with air by lowering its surface tension. Got it? Instead of hooking together, it wants to let go. All right? All righty. Please don't forget, veins and arteries are opposite in color in your lungs because they're doing opposite jobs and flowing in opposite directions than the rest of our body. All right. Pulmonary arteries and pulmonary veins. Got it? Now, bronchial arteries and bronchial veins. What the heck are those? Do you have a picture? Yeah, I do. Okay. See how one is dark red and one is more of a scarlet red? This is your bronchial vein and your bronchial artery, pulmonary artery. Got it? Pulmonary. Going to and from the lungs, right? We bring in the blue goes in and it immediately becomes red. Got it? But then it goes whoop, back up to the heart. Does any of this blood flowing back to the heart feed the lung tissue? No. Just like none of the blood flowing in the middle of your heart feeds your tissue. Those are the coronary arteries and the cardiac veins. Got it? Same thing here. We have a couple of branches, and that's why they made it a different color. This is the bronchial artery that feeds the living tissue. Got it? And the bronchial vein, which picks up that blue blood after it's been exchanged. Got it? So, my friends, I want to make sure you keep a running list, whether I'm in class or whether you're watching my videos. Make a running list of how the circulatory system, including the heart, is parallel to the respiratory system. What do they have in common? The magical word in English is analogous. How do you spell that? Analogous. Comes from analogy. Okay? Analogous means they have things in common. So what do they have in common? That the main fluid flowing through the middle of it does not feed the tissue. They have to have their own circulatory system. Got it? Okay. Also, what are the cells of your capillaries? Simple squamous. And what are the cells of the alveoli? Exactly, because they both have to exchange gases. So let's do it through tissue paper thin, one layer of cells. All right, do we have nerves in our lungs? Yep. Sympathetic to make our lungs open up so we can run, right? I got to get away. You want to breathe, don't you? So you can get some oxygen into your tissues. But when you are resting and digesting, they can constrict. We don't need them. Does that make sense? What's the problem with anaphylactic shock? What's going to kill you? Your blood vessels open up, but what do your bronchioles do? They tighten up and you can't breathe. So, what do we? Because epinephrine will open these and tighten these. Isn't that cool? It does exactly, because it does sympathetic. It'll tighten these down to get your blood flowing again, but it'll open these up so you can breathe again. Isn't that smart? Yeah. So, helpful to know. Have you ever seen commercials for asthma where they say, don't replace your rescue inhaler with this? The regular inhaler has corticosteroids to force you to open up your bronchioles. But if you're dying, you don't have time for that. You need your epinephrine. You need the rescue inhaler that'll immediately open them up. Does that make sense? At the same time, do you want to use your rescue inhaler 10 times a day? No, because that'll make your heart go nuts. Got it? Okay. All righty. What are some... What happened?
Will you go back to the last slide real quick? Right there. Okay, good question.
What?
Yeah, but this is helpful. I got it.
Yeah, this is helpful to know. Yeah, it's helpful because it's going to tighten this, open these, epinephrine. No, it'll open these and tighten these. See, I'm going to throw it opposite in there and see who goes, yeah, that's right. No. The anaphylaxis will make these constrict and these dilate. What's epi going to do? Make these constrict and these dilate. Opposite. Got it? Okay. So be careful. All righty. Look at some of the things that could irritate our lungs. Ever heard of asbestos? Okay. That's asbestos, folks. It's actually a rock, but when you heat it up, it'll puff out in little tiny strands. Got it? Trapping air in between, which is exactly why they use it for insulation for many, many years. Now we realize it's not a good idea to breathe because every one of these little pieces of asbestos has hooks on it that hook into your alveoli and don't ever come out. So it's like a little harpoon that's constantly jabbing your alveoli. And if it keeps jabbing your alveoli, what if it jabs it directly in the middle of your DNA while it's dividing? No, you're not dead. You're going to change your DNA into something that's cancerous. That's why asbestosis leads to cancer. Okay? Does that make sense? Okay. That's why you need people with the hazmat suits and breathers and stuff. You might have seen this on those fix-em-up shows, where they try to fix up a house and go like, uh-oh, we found asbestos. Everybody get out. And they basically cover the whole house in plastic and cover themselves in plastic while they're taking all the stuff out. All righty. Now, you know the pleura, right? The double layer of stuff around your heart, around your lungs. Okay. What's the purpose? To reduce the friction. Okay? But the only reason they work is because of a pressure gradient that they create. All right? You will definitely have disease after disease after disease on this test. So put a big star every time you see a disease. This is pleurisy, inflammation of that bag that's around your lungs. When you have inflammation, don't you get swelling? Swelling is edema. This is edema of fluid inside that double-layered sac. Got it? If that sac fills up with fluid, is it not pushing on your lungs? Okay. Thing is, it doesn't push on your lungs this way, it pushes on your lungs this way because it fills up from the bottom. That's what this is. This lung is fine. I can see an x-ray right through it. What happened here? This bottom area is now full of water. Got it? Making this lung get smaller and smaller. Are they going to have a good time breathing? No. And because this is water in the chest, we call it pleural effusion. We're building up water, but not in the lungs, because then you're drowning. This is water outside the lungs in the sac. Got it? Pushing up. Okay? Making the lungs smaller and smaller. Are you with me? Okay. Pleural effusion. All right. Breathing. Inspiration is what? Breathing in. Expiration is out. Yeah. In is in and X is out, right? Okay. What is the motto for the state of South Carolina? On the State House and
As
on,
I breathe out, as I
Keep-
live, as I.
Now live on
breathe,
live.
As I breathe, no, I think,
Okay.
some,
anybody?
I don't remember.
All I agree, I serve the Lord.
It's Dum Spiro Spero.
Yeah.
Dum Spiro, Dum means while, D-U-M, while I breathe in, Spiro, I hope,
Yeah.
sparrow. See, what is despair? No hope. Got it? Despair, sparrow, hope. Okay. Dum Spiro Sparrow. All right. See that in yellow? We've got to memorize that. That's the pressure of the air pushing on you and me right now. It's about 760 millimeters of mercury. Don't worry about the millimeters of mercury. That's just the unit that we use because they always used mercury barometers in the 1800s. Now we don't. We use computers, but we call it still mercury. Okay? Millimeters of mercury. 760 is atmospheric pressure at sea level. We're only a couple hundred feet above sea level here, so it's still close enough to 760. Got it? What is air pressure at the top of the mountain? More or less? Less. Why? Because air molecules are pulled to the earth by gravity. So where do we have more air? Down here. Where do we have less air? Up here. Anybody ever been in an airplane? Do you fly with the windows open? Why? There's not enough air out there to breathe. How high up does an airplane, does a jet fly? Yeah, high. Between 6 and 7 miles. Okay? And that's because this is where we have the least resistance. Got it? There's more resistance where there's more air down here. There's less resistance where there's less air up there. Does that make sense? Okay. So, is there a lot of air on top of Mount Everest? No. In fact, very little to breathe. That's why the top of Mount Everest, we call that the death zone. Okay? When you go up that last part to get to the top, take your selfies and get your butt back down, you'll be dead in an hour or two. Okay? Because you'll eventually fill up your lungs with fluid because we can't maintain enough pressure coming in. I'll show you how that works as we go through the chapters. Okay? Are you with me? So, that's why when you climb Mount Everest, you say on the last day you assault the mountain because it's get up there, take your picture, and get down. Alrighty? About 5 or 6 years ago, pre-COVID, the Himalayan authorities said, you know what, we usually only let 10 people climb. What's this? Your trachea. Is it closed or open?
Open.
Always or sometimes?
Always.
Patent. Always. Got it? That means, what's my pressure out here? 760. So what's my pressure in here?
760.
760 also. In fact, right now, if we just stop breathing, we've equalized the pressure in and out. Got it? Just sit there without breathing. It's in and out, same pressure. So how do I breathe? Well, if I want to breathe in, do I make my chest bigger or smaller? By making my chest bigger, what am I doing to the pressure in my lungs? Higher or lower?
Lower.
Lower. And that low pressure pulls the air in. I don't even have to try it. Can't I breathe when I'm asleep? Can't I breathe when I'm knocked unconscious? So all I have to do is make this a little bit bigger and I can pull in the air. What's the pressure out here? What does the pressure have to be in my lungs to breathe in? Lower. By a lot? No. I can be 759. 1 millimeter of mercury less, and I pull all the air that I need. Got it? So, how do I breathe out? Make my chest smaller, diaphragm up, ribs in, make my chest smaller, and what happens to my pressure? It goes up. Does it have to go up by 10, 15, 20? Just by 1, 761. Got it? That's why 760 is the key number to remember. That's stabilized in and out. Okay? Are you with me? Now, let's talk about the Mount Everest experience. Your lungs are made of tissue paper thin alveoli. And if I didn't have this cavity here, I would collapse my lungs to smaller than my fists. Is that a good idea for breathing? No. So what keeps my lungs open is that they're glued to the pulmonary chest cavity. Got it? And how are they pulled there? What's holding that against my whiteboard? No, vacuum doesn't hold anything. Nope, that is lack of something doesn't do anything. The 760 in here is pushing against this because there is less than 760 after I push the air out. Got it? But it's not the vacuum that's holding it, it's the higher pressure on the outside that's holding it. Does that make sense? I haven't changed this, all I changed was the pressure underneath. Got it? And it'll be held in place. What's the pressure, intrapleural pressure? Is it 760 or is it less? It's exactly 4 millimeters of mercury less. And as I breathe in and out, it changes. It stays -4. Got it? Take a look. See how if I'm breathing in and out, I've got to keep that a -4 to keep my lungs pushed against my chest cavity. Got it? So, if we go back, how much force is there in 760? Who wants to sit in this chair? Hopefully you're gonna roll.
I'm too heavy.
Oh, okay, I need somebody lighter. God dang. Stacy, you're light enough, come on. Oh
I gotta
God,
make sure the chair goes with me.
that chair sucks.
Trying to-
Okay, it doesn't roll, sorry.
Yeah, it-
Fill up with fluid. Got it? As your lung collapses, it fills up with fluid. Less and less chance to breathe. Got it? You're not drowning in the clinical sense where the water is in your alveoli, but you are basically drowning because your lungs are filling up with fluid on the outside, making them smaller and smaller and making it harder and harder to breathe. Does that make sense?
Where's the fluid coming?
It comes from the serous fluid that's here. That serous fluid builds up. Now, not immediately, but it builds up over time. Got it? And that's why it's dangerous to be up there. Are you with me? What about all the Sherpas? They live there and their bodies are already acclimated to this. When Western